It's clearly obvious there is significantly more demand than there is capacity today. The number of people calling 119 and visiting the website would be 3 to 4 times the number of tests that we currently have available, but there will be some double counting in that.
Leaving aside people having to call multiple times because they can't get through, strip that out. How many people want to test? Then we'll relate that to how many tests are available.
I think, well, it is multiples of the total test capacity we have today.
The target that you're given by the Prime Minister is a 24-hour one, the 24-hour turnaround. The figures that you quoted to us were next day. The figure is 33%.
Yes, as I said, I know it's significantly low.
2/3 don't meet the target of 24 hours. There's a chain there. So if you have a delay in getting a test, and then there is a delay in getting the results of the test, and then the time that it takes to trace those contracts, the smaller and smaller proportion of people who test positively and are symptomatic have their contacts being tested. In other words, according to SAGE, it drives an increase in the R number. So isn't it the case that the failure of the testing regime, which I hope is temporary, is driving the increase in the pandemic across the country?
I strongly refute that the system is failing. So, as I said earlier, we made a conscious decision because of the huge increase in demand to extend the turnaround times in order to process more tests over the course of the last couple of weeks. And whether or not you get your test results at 2 in the morning or at 8 in the morning, actually our judgment, and it is a judgment, was that it was better to meet more of the people who were really worried and scared and wanted a test. We flex that across each channel and each laboratory, as I said, several times a day, 7 days a week. And as we bring on more capacity, I would expect those turnaround times to go down. But that is a balance, and the whole system is an end-to-end balance that is about us playing our part in expanding testing capacity, but it's also about all of us playing our part in only coming forward for tests if we have symptoms.